Good evening. Hello, everybody. I hope you can see me. I'm Charles Kingsland, Professor Charles Kingsland. I'm the Group Director for Care Fertility, and I am based in Liverpool. And tonight we are going to talk about treatments. What treatments are available to you, what treatments you should have, what treatments you shouldn't have. We've had a lot of questions in, so I'm going to try and answer as many as I can. But what I like to do is to just give you some sort of background about treatments and what might be good for you, what might not be good for you. And it's the same in the whole of medicine, not just fertility, because the principles are the same. So I'm going to show you this chap who sits on my desk, doctor called Hippocrates. Now, Hippocrates was the father of modern medicine, and he developed all the principles of modern medicine on the island of Kos. That was, it's one of those Greek islands that we can't visit anymore in case we spread our COVID virus. And he developed the principles of modern medicine. And when you qualify as a doctor, you have to swear the Hippocratic Oath. You have to swear various things that you will do and you won't do as a doctor. But the most important thing that we have written into our contract as a medical practitioner is, first, we do no harm. So we're not here to harm patients. Now, the corollary to that, which is quite scary, is that we're actually not supposed to do any good. We're not here to make you better. What we're here to do is not to make you worse. Of course, nowadays, the vast majority of you are made better by going to see the doctor, and that's what we want to do. But things weren't like that 100 or 200 years ago, and things were positively dangerous 200 years ago if you went to see your doctor, because they used to feed you all sorts of potions and pills that had no basis in science whatsoever. And I always quote, famous people who've actually run into trouble by going to see the doctor. Wolfgang Mozart, for example, he developed a chest infection just after coming back to from seeing his opera, the first night of his opera, The Magic Flute. He developed a chest infection, and his doctor came and administered liquid lead to him on the basis that might be beneficial. Well, he died a week later of convulsions, which they thought was due to the rapid advancement of the pneumonia, but it wasn't. It was the lead that poisoned him. Similarly, Napoleon Bonaparte was killed by his doctor because he went with stomach complaints and was given all sorts of potions which ended up poisoning him. Anyway, less of those people, because they don't come into our story tonight. However, what I'm trying to say is that medicine was based on myths and legends and stories, and we all like a good story. Lucky Heather, Rabbit's Foot, all sorts of strange pills and potions which may or may not be of any benefit. And then more recently, we developed the concept of evidence-based medicine. Now, evidence-based medicine has revolutionized the way we practice. And evidence-based medicine is we offer treatments on the basis of incontrovertible scientific facts, which prove unequivocally that whatever we advise you to do, whether it be a nurse or an embryologist or a scientist or a doctor, it's been proven to be of value. Okay? So, for example, now we're going back to fertility. If you've been trying for a baby for 1 or 2 years and you've had your investigations, and then the time comes to be offered some treatment, what we want to do, if at all possible, is to give you evidence-based treatment. So treatment that is unequivocally of benefit for you. Now, there are 4 grades of evidence-based treatments. Grade A, that is, which has been proven beyond doubt that the medication will be of benefit to you and will not be harmful. Now, the classic examples of grade A evidence-based medicine in fertility are things like weight. There is no doubt that if you are of the appropriate weight, your fertility will be higher than if you are of low weight, or whether your body mass index is in excess. So in excess of, and the way to work out your body mass index is your weight in kilograms divided by your height in meters squared. And the ideal weight is 20 to 25, okay? If you're over 25, your fertility is lower, and if you're under 20, your fertility is also lower than if it's between 20 and 25. That's a fact. Now, of course, we know people who are overweight or who are positively obese who get pregnant, but that's them. That's not us. They may have started off with a higher fertility. So, body mass index, grade A evidence. Smoking, it is grade A evidence that if you smoke, you are at risk of a lower fertility than if you don't smoke. Then, and the classic one that we advise all the time is folic acid. Take your folic acid. There is no doubt that if you take folic acid to supplement your diet, you have a better chance of having a healthy baby than if you don't take folic acid. They are grade A. Then we have grade B evidence. Now, grade B evidence is, it's not been proven by the strongest, best tests, but some less scientifically robust tests have proven it might be of benefit. Now, the one that I quote there is for those of you who've had IVF and you've had an embryo transfer. Grade B evidence is if you there is no benefit by lying on the bed after an embryo transfer. In fact, there is grade B evidence to suggest that if you get up quicker and you don't rest, that your chances of getting pregnant are actually higher. So we don't advocate you lie there. Now, if you want to, that's fine. But by standing up after an embryo transfer, the embryo doesn't fall out. It actually floats further up. And when you empty your bladder, people say after an embryo transfer in IVF, I'm afraid that I might wee my embryo out. Well, actually, the bladder is lower than your uterus. So if you empty the bladder, you go for a wee after your embryo transfer, your embryo actually goes further and further up into your uterus. You can't wee it out. And that's grade B evidence. Then there's grade C evidence. And this is where the legends and the myths and the stories come out. Now, grade C evidence is there is no evidence that it's of any benefit, but similarly, there's no evidence that it's harmful. Okay? So you've got lots and lots of things that fall into this category. Loads of things. Royal jelly. Now, that's a treatment that we all think, well, royal jelly, royal, made by bees. It's got it, comes in a blue glass box, sold in a health food shop. That's got to be of benefit. What for? Royal jelly has never been shown to be of benefit for anybody ever, but it's not harmful. So if you feel like taking it, take it. If you believe that it's of benefit to you, and you've read the stories and the myths and the legends about royal jelly, and there might be one or two little trials that have shown it to be of limited benefit, take it. But if you get pregnant, you cannot say it's because of the royal jelly. You've got pregnant by coincidence. It's despite the royal jelly. That's what we know about that treatment. Now, as I said, it's provided you know, you can do what you like. But to hang your hat on royal jelly, for example, then that's just there's no evidence. But there's no evidence that it's not good for you. Just no evidence that it's any good for you. But, and it's the same with some vitamins and minerals. You've got to be very careful when you're told to to do something, take something, to know what you've the bus in front of me drew up. I drew up behind the bus, and on the back there was an advert, and there was a chap there. He was yawning with his beautiful teeth and his lovely manicured hair, and was it manicured teeth and beautiful hair? I don't know, one or the other thing, one way round or the other. And it said, "Are you tired? Are you listless? You need to take this." And I thought, yeah, I'm tired, I'm listless, I need to get that because I want to look like him and be younger and more vital. And then at the bottom, it says, this particular treatment may help in tiredness and listlessness. It's a bit like, you know, the cat food. 8 out of 10 owners who expressed a preference said their cats preferred it. 8 out of 10 who expressed a preference. That means there might have been 1,000 people who didn't express a preference. So there was 8, not 8 out of 10, it was 8 out of 1,000. So that, you know, 8 out of 10 owners who expressed a preference said their cats preferred it. That actually means nothing. And it's the same with hair adverts. You know, you see these adverts and it says cis linoleic in this new hair product. It's proven to be a benefit. And then at the bottom it'll say, in a poll, 67 out of 75 people. Well, that doesn't mean anything. Why 75? Was that a proper trial? Was it randomised? Was it controlled? Was it prospective? How did they measure it? What was the beginning? What was the end? It's coincidence. So you have to be careful when people say things. I had a patient who said to me the other day that every day she eats McDonald's chips because she's convinced that chips are good for her, because somewhere along the line she's read that chips have some sort of ingredient that give you fertility enhancing powers. Really? Do you really believe that? Do you think there's a scientist working on a particular chip to say this will aid your fertility? No. If you get pregnant while eating chips, then that's coincidence. Now, it's the same with many vitamins and minerals and supplements. DHEA is another one, dihydroepiandrosterone dione acetate. Now, that is a building block for estrogen. And a lot of people with a poor egg count, or maybe a little bit more mature, over the age of 40, will be advised to take DHEA because it enhances your estrogen producing mechanism. Now, there is very little evidence to suggest that if you take DHEA, it will make you more fertile. Very little evidence. I don't think it's even B. I think it might be C. I might be doing DHEA a disservice. However, it's not harmful. And if you want to take it, then fine. But it's like food supplements, pineapples, walnuts, stopping alcohol altogether. Where does it say you must stop alcohol altogether? Reduce alcohol, not stop alcohol. I'm not advocating we all go out and get drunk, but it's the same with, you know, do you really believe that there's a scientifically proven project that has proven that eating walnuts is going to suddenly magically make you pregnant or improve your fertility? No. However, if you eat walnuts, if you follow good dietary advice, then you're probably eating good food. You're probably not eating all the junk food and the, you know, some of these sugary drinks, which are poor diet, which are more likely to make you overweight, which makes you less fertile. So they are linked, but, you know, if you've got a good diet, don't just sit there quaffing pineapples or for some reason it's going to help you get pregnant, because that is coincidence. A good diet that maintains your body mass index, that's evidence-based. Okay, so, but we all love a good story. You know, I'm from Nottingham. Robin Hood, as far as I'm concerned, it exists, and he, you know, stole from the rich to give to the poor, and, you know, that's good. But it's a myth. It's a legend, but we like those stories. And if we like them, and if it makes us feel better, then do it, as long as we avoid category D. Category D, which we call, which we talk about in care fertility, our clinics across the country, is treatments which are harmful. There is no evidence that they do any of benefit, but not only are they not of benefit, they can be harmful. Chinese that not only are there no benefit, but they are built on legend, myth, stories, history, but they're harmful. They can actually do is to avoid those sort of treatments altogether. So there are some things that you can have and some things that National Health Service, there are what the National Health Service try and do, what we try and do is stick very rigidly to evidence-based medicine. You know, the NHS tends to fund only things that are unequivocally of benefit. However, there are other things that may be showing grade B benefit, the other things that are grade C that you may want to take. Now, that is up to you, but the crux is that your doctor should tell you what are the benefits, what are the risks, and you should ask. So if your doctor says, well, based on these tests, you need this treatment, then you should say, well, what evidence have you got that this is going to do me any good? And he or she should be able to tell you incontrovertibly, absolutely, this is the benefits, these are the risks. Then it's up to you whether you want to take them. I'll give you an example. Clomid. Now, Clomid is a tablet that we give to help you to release an egg. So for couples who are experiencing infertility because of anovulation, so the female has eggs, she's just not ovulating them. Clomid is a very good, very powerful ovulation induction agent. Now, if you're of the right age, of the right body mass, you're well hydrated, you have all of the parameters are normal, you have a normal pelvis, you have a normal sperm count, but you're just not releasing eggs, then Clomid, if you take Clomid for 6 months and you ovulate for 6 months on the right dose, the lowest dose that we can safely give you, 50% of people will be pregnant within 6 months. Now, if you take Clomid and you have unexplained infertility, so you're ovulating and your pelvis is normal and the sperm is normal, but you are still given Clomid, then 5 of you will get pregnant, because Clomid has no place in the treatment of unexplained infertility. However, we don't know whether it's harmful or not in unexplained infertility, so some of you will be prescribed it. Now, I'm not saying that's a good thing. I'm not saying it's a bad thing. But what I'm saying is that if you get pregnant whilst you're taking Clomid and you have unexplained infertility, you are ovulating already, it's not going to make you ovulate better. You either ovulate or you don't. If you don't take Clomid, 50% will get pregnant. If you do ovulate and you take Clomid, if you get pregnant and 4%, 5% will get pregnant after 6 months, that's coincidence. So the treatments you take are the treatments that you should know why you're taking them. And if you say, look, I know that this treatment is not doing me any good, it's not harming me, and it makes me feel better, well, fine, because it makes you feel better, you may feel very positive about it. You know, for those of you who've been treated by me in the past, one of the things that I always do after I do an embryo transfer, I have to shake your hand, and it's been very difficult for me to not do that in Clomid, but because I think that the process of shaking people's hands helps you get pregnant. Now, you know as well as I do, that's just, you know, mumbo jumbo, but it's important to me, and it's important, and it makes me feel better, makes me feel positive, and if that's the case, probably makes you feel more positive. So that's the thing about treatments. Now, we've got one or two a lot of questions. So I'll just try and run through them in the last 10 minutes based on what I've said, based on evidence, do no harm. When you go to see your fertility doctor or your fertility nurse, when you've been trying for a while, and you have the tests, which we told you about in a previous Instagram, then we're on to the treatments. You ask the question, is it going to be doing me good? Is it of doubtful benefit? Is it of no benefit? Particularly if you're paying for it, you need to know what this, whether this is going to be a benefit to you. So, do you need any additional tests if you are going to have treatment with a sperm donor? No, not necessarily. You need to know that the background of the sperm donor, ethnicity, height, colour of eyes, colour of skin, so you can choose your donor. But those donors will have been screened, they'll have been rigorously tested, so there's no additional tests. And for you, no additional tests. As long as you've got a healthy pelvis, normal tubes, normal ovarian reserve, then donor insemination is probably for you. If you've got any other factors, then you may need assisted conception, which is IVF or IUI, but depending on what your doctor or fertility nurse advocates. Does high BMI affect treatment? Do you need any additional treatments if you have a high BMI? Well, there's one thing having a high BMI. There's another thing, the doctor saying, well, can you get your BMI down? Because you and I know that losing weight is very challenging, particularly if you have particularly hormonal anomalies like polycystic ovarian syndrome. So, but again, evidence-based, grade A, if you can get your body mass down, that's the best treatment you can do. And in many cases, that might be the only treatment you need, because losing weight will get you to ovulate. If you lose weight, you've probably got a better nutrition, and that might be all you need. If you can't, then there are additional treatments that we might need. For example, if you need IVF, you might need a high dose of hormones to get the eggs mature and out of use, which is it's nice to avoid it if you possibly can, but that's one of those issues that you need to think is trolling. So CB, I can't say your name. This is so have been completely obsessing over my partner's diet. No, don't obsess. If you obsess about your diet, you get stressed, and if you get stressed, you might get distressed. And if you're obsessing about your diet, then you might not want to have sex because it's doing your head in. And then if you don't have sex, you don't get pregnant. So don't obsess about your diet. And I get people who come to see me and say, oh, I haven't had any alcohol for 14 years. You think, why not? That's mad. You mean you cut out the things that you enjoy? Don't drink, but to excess, but 3 or 4 units a week. Are you going to tell me that's going to stop you getting pregnant? No, of course not. Also, any advice on exercise reduction? What I say about exercise, I've said it before, it's good to exercise, it's bad to exercise too much. If you're running the equivalent, or if you're exercising the equivalent of running more than 15 miles a week and you're trying to have a baby, that's too much. Run back, come back on the exercise. Don't over-exercise. It's nice to be healthy and fit. It is not necessarily good to be too fit, and it's certainly not good to be too healthy, because that can, great, I'll grab a wine then. Never drink, I'll never drink before your breakfast. No, I'm kidding. Grab a wine, but not too much wine. Occasionally, 3 or 4 units a week, that's fine. Lots of additional services are on the price list. What's right for me? Well, That's a classic, because when you start your fertility journey or your fertility treatment, it can be completely overwhelming. There's this, there's that, you'll read this, you'll go on social media, as all patients do, and you'll read lots and lots of stuff, and you'll want to ask lots and lots of questions. Well, ask them. It's so important for people like me to sit in front of people like you and answer the questions that are bothering you. And I've said this before, I'm not bothered how daft the questions are, because believe you me, if you think you've got a daft question, I'll have answered 100 dafter ones, and I'll have asked 100 dafter ones to doctors myself, because when you're in that position, you're very stressed, you're vulnerable, you want to know all the questions. Common sense sometimes takes a back seat. So ask, and be clear. There's no excuse for saying, I don't understand what, particularly if you're going in the private sector, the funding is not available to you on the National Health Service. Ask the question, because you're paying for it. And if you're paying too much for things you don't understand, then that's negative. That's grade D evidence. So ask before you pay. You know, if it's like buying anything in any treatments or anything, any shops. Ask before you go ahead. Look at the risks. Look at the benefits. Hopefully the doctor or fertility nurse or the scientist will tell you what is best for you. Okay? What's better? And then you decide. And then some people like to be in control and say, that's great. This is my evidence. This is what I've learned. This is what I want to do. Fine. Brilliant. But there are some people who want to be led. And that is, right, you've told me this, you've told me that. I trust what you're saying. You tell me, what do you think is best for me? I have to say that, you know, when I go to the doctors for ailments, I'm in category B, but many of you are in category A. So, and you know as well as I do, some of the stuff on social media is helpful, but some of the stuff is scarily unhelpful. So evidence-based medicine is the key. Right. Is there treatment for a low antral follicle count? Well, it's never good to have a low antral follicle count, but there may be. And these are the sort of questions that you need to go and ask your doctor. You know, what's right for me? Because we are all individuals. It's all right saying, you know, the classic is, you know, what's your success rate? What's the success rate of your clinic? Or conversely, we are the most successful clinic in the country. Well, or you may read that. Does that mean it's successful for you? You know, I want to know, what is my success rate? What is the chance of me getting pregnant in your clinic? Okay, that's what you need to know. You don't want to know what's the success rate of everybody else. You want to know, given my diagnosis, given my treatment, make sure you've had the right investigations. Right, if I have this treatment, what are my chances of getting pregnant? And how much is it going to cost me? Okay, so you know the cost, you know the amount of time, you know the chance, and then you decide what is best for you. And if you're not happy with the information you give, go somewhere else and get a second opinion and see what they say. Because, you know, I've said it again in previous Instagrams, it's what's right for you. You know, choose the clinic that's right for you. Choose the people that you can trust. But make sure the clinic's accessible. Make sure you can, you know, I said to a patient the other day, you know, what's the point in coming to a clinic if you can't park, you can't get there, it costs a fortune, you don't know where it is, you get lost, you go there, you don't know who you're seeing, you don't know how long you're going to be seen for. Well, try and eliminate these sort of stressful factors. You know, check out the clinic. Where is it? Can you park outside? Who are you going to see? How long are you going to see them for? Are you going to be able to ask the daft questions that you want to ask? Are you going to be able to give the information, you know, that that you've read on the internet? Is that any good? What do you think? And then you make that decision based on the evidence, grade A, grade B, grade C, grade D, the cost if you're not getting it on the National Health Service, the additional treatments, are they a benefit, are they not a benefit, and then you're halfway there. You're well on your way to the journey. You're in control, or you're being controlled, but you know but that's what you want to happen, and you know exactly where the beginning, the middle, the end. So at the end of the day, you can say, I've done my best. There's nothing more I could have done. You may be happy, you may be disappointed, and most of you, I hope, particularly if you come to care, will be happy, but you've done your best. And then all we doctors and scientists and nurses across our care group, all we want to do is to do the best for you, to give you the best chance to achieve what you want to achieve. And if that happens, if it doesn't happen, as long as we can say we've all done our best. And it's 7 o'clock. Gosh, that was a quick half hour. There are lots and lots of questions still coming through. I will endeavour to. Chloe's on the other line. She's taking all your questions, and we'll try and answer them if you want to email us. Alternatively, you can phone our general inquiries team. They're always always available to help you. Or if there's a care clinic close to you and you do think you might have a fertility problem, or you're thinking about, you just want to ask some questions, just give us a ring, and we're happy to help. So thanks for listening. I shall see you again in a couple of weeks. And oh gosh, the sun's come out. Have a good evening. Good night.